How to reverse insulin resistance, because let's face it, your body naturally produces the hormone insulin, but it does so to help keep your blood sugars at healthy levels. But sometimes your body doesn't even know how to respond to insulin the way it should, and this is known as insulin resistance. So in this video, we'll look at the 3 big questions: what causes insulin resistance, all the symptoms that you should know of, and how to reverse it. So you don't want to miss this. Stay tuned till the end. Hi guys, Yaseen Arsalan, media pharmacist here on YouTube, where I help you guys make better and more informed decisions about your health and wellness. So if that's something you're into, be sure to smash that like button below now. Also, while you're at it, hit that subscribe button too, and don't forget to follow me on Instagram for more behind the scenes. So without further ado, let's get straight into it. Before getting into what it actually means to be insulin resistant, let's briefly look at what insulin does in the body without getting too technical, because I think it's important for painting the picture correctly. Insulin is a hormone that helps regulate your blood sugar, and it's made by an organ known as the pancreas that sits behind your stomach. And your pancreas sends insulin into your bloodstream after you eat a meal, or if it detects that your blood sugar levels are high. Let's say if you have a bag of these. Once the insulin is in your bloodstream, it has 2 jobs. One, to take the sugar out of your blood and send it to your cells so it can be used for energy. This is because our bodies don't always need a sugary bloodstream. We need to put that sugar to good use, and most of the cells in your body contain what's known as insulin receptors. So think of an insulin receptor like a lock and the insulin hormone like a key. When the key opens the lock, or when the insulin binds to the insulin receptor, the cell opens to let sugar in, and once it's in, your blood sugar levels should return to normal. So that's the first job it has. The second is to take the sugar out of your blood, and this time store in muscles, fat cells, and the liver. And this is so that I could use it for later. And when it's stored, the original form of sugar, glucose, becomes another form of sugar known as glycogen. So think of an insulin as the signal for your body to begin shuttling in the sugar in the blood, either into the cells for energy or into muscles, fat cells, and the liver to store for later. But where does the problem of insulin resistance come in? And what does it mean to be insulin resistant? You see, insulin resistance occurs when cells in your muscles, liver, and body fat begin to resist or ignore the signal that insulin sends out. If it ignores it, the sugar stays in the blood and doesn't get shuttled in anywhere. In other words, instead of being sensitive to the effects of insulin, they become resistant to the effects of insulin, and when sugar stays in your bloodstream, a number of different issues does arise. Prediabetes, type 2 diabetes, and more serious damage to nerves and organs. Now that we know a little on the role of insulin and what it means to be insulin resistant, we can look at the first big question: what causes insulin resistance? And there are a number of different causes, but the 6 causes I have seen the most are: 1, living a sedentary lifestyle, such as long periods of inactivity or physical exercise. 2, being overweight or obese, specifically when we talk about visceral fat, which is a major factor in high insulin resistance, given that it accumulates before insulin resistance. Number 3, a poor diet, which is any diet that is high in carbs and sugars. Number 4, PCOS, which is a condition that affects a woman's reproductive health, but also causes high levels of insulin, which can lead to insulin resistance over time. Number 5, a high dose of steroids taken for longer than a few weeks. And lastly, number 6, chronic stress. Since stress causes your body to release its own stress steroids like cortisol. So if you think high cortisol is the issue, click the video I made up here to learn how to reduce high cortisol. And of course, there are cases in which having insulin resistance may not be your fault at all, like genetics or having a family history of insulin resistance or diabetes. So keep that in mind too. The second big question is, what are the symptoms? Now that we got the causes out of the way, let's look at some of those symptoms. And in the beginning, your body tries to fight the effects of insulin resistance by releasing more insulin, but the cells are not responding to insulin as well as they should. So for a while, more insulin in your bloodstream helps keep your blood sugar levels normal, and you may not have any noticeable symptoms of insulin resistance in the beginning. But over time, as insulin resistance gets worse, even more insulin won't be able to make up for your cell's weak response to it. And at this point, high blood sugar levels often become the first symptom of insulin resistance. And as high blood sugar persists, you may begin to notice excessive thirst, frequently needing to go pee, more headaches, feeling hungry after a meal, feeling more tired than usual, tingling sensations in the hands and feet, and more frequent infections. But because you have any of these symptoms, that doesn't mean you have insulin resistance. To actually know, you need a diagnosis which is done with the A1C test, which measures your average blood sugars over the previous 2 to 3 months. And your doctor will reconfirm these tests later as well. A fasting blood glucose test, a glucose tolerance test, and random blood draws. And your doctor may recommend doing these tests if you have high blood pressure, if you have a sedentary lifestyle, have excess body fat around the waist, have high cholesterol, or if you're showing any signs of prediabetes, because the end goal is to prevent worsening complications and the development of full-blown diabetes. Now, the last big question: what can I do in the meantime to start reversing insulin resistance? And instead of overwhelming you with a huge list of things you need to start adding into your daily routine, I'm gonna make this short and sweet so you can truly focus on them. And there are 3 things that I think can make an improvement if you do this efficiently. The first, get in at least 30 minutes of physical activity most days of the week. Exercise is one of the fastest and most effective ways to reverse insulin resistance. Both aerobic and resistance training can help to reverse it, so combining them in your workouts seems most effective. The second, lose belly weight. A study at Johns Hopkins University found that people with prediabetes who lost 5 to 7% of their total weight over 6 months reduced their risk for type 2 diabetes by 54% for the next 3 years, which is huge. And lastly, number 3, protein and low sugar. Protein helps keep your body's blood sugar levels stable, whereas high sugar diets can cause spikes in blood sugar that only make insulin resistance worse. So following a meal plan that is recommended by the ADA can help improve that insulin response. And I left a link for what that looks like down in the description, so don't forget to check that out. And I know I'm gonna get asked if there are any spices or herbs that I should be incorporating into my diet, and while the research on them is recent and done mostly on animals, I do have some recommendations that wouldn't hurt to try. Fenugreek seeds, as they're high in soluble fiber, which helps make insulin more effective. Turmeric, ginger, garlic, and cinnamon, which is said to increase insulin sensitivity by increasing glucose transport into cells, and may even mimic insulin to increase sugar uptake from the bloodstream. Digging through some more research, I also found several studies which have found that drinking green tea can increase insulin sensitivity and reduce blood sugar, and this could be due to its powerful antioxidant EGCG, which many studies have found to increase insulin sensitivity. So I am optimistic in these, and I do believe that they are the best foods we have right now to point us in the right direction. And that's it, guys. The good news is that there are many things you could do to naturally increase your insulin response and beat insulin resistance. Making healthier lifestyle choices are the best way to help get your sugar levels in check. So let me know if this helped you in any way. I also hope that this video helps give you a better understanding of insulin resistance as a whole. I also hope that this video was insightful as well. The only thing I ask for return is a simple like down below for the YouTube algorithm. Thanks for sticking tuned all the way till the end, and as always, I'll see you on the next one.